Hello, John. It's good to see you today. I want to thank you for coming in so that we can review the results of the few assessments you recently took. Before we go over the results, I just want to give you a quick recap of the assessments that you did complete. You completed the Beck Depression Scale, and that assesses your level of depression. You also completed the Beck Hopelessness Scale, which focuses on hopelessness, feelings about the future, and loss of motivation and expectations. The Beck Scale for Suicide Ideation, which you also completed, gauges one's thoughts surrounding suicide. And lastly, you completed the Beck Anxiety Inventory, which assessed your level of anxiety. I appreciate you taking all of these assessments. This helps me so that we can gain a holistic view of everything that you are experiencing. The information obtained from these assessments is extremely beneficial in developing a treatment plan. So let's start with reviewing the assessments of the Beck Anxiety Scale. The results place you in the moderate range with a score of 18. A score of 30 is the start of the severe range, so your score puts you pretty close to being in the middle. With regards to the panic-related symptoms, you responded that you were unable to relax, you have a fear of losing control, and that you sometimes have difficulty breathing. For the anxiety-related symptoms, you replied that you often feel hot and shaky. Of those questions, you responded all those were in the moderate range, while the remainder of the questions under the Beck Anxiety Inventory were scored to be in the mild range. So does that sound about right to you? So before we move on to the other assessments, do you have any questions about this one? Okay. With respect to the Beck Hopelessness Questionnaire, you scored a 13, which indicates that you were in the moderate range. Just for your reference, the severe range for this assessment starts at 15, so you're on the high side of the moderate range. You responded that you feel the future seems dark, you see unpleasantness ahead of you, and that you never get what you want, so therefore you really don't want anything. Has anything recently changed with the statements that you have provided or the answers? So do you have any questions about this assessment before we continue? Okay. Another assessment you completed was the Beck Depression Scale. And as I said, it rates your level of depression based on the answers you provided. Your results of a 32 indicate that you are in the severe range for depression. You responded that you feel guilty and sad all of the time. You're disappointed in yourself. You cry over every little thing. You have lost interest in people or things, and you often feel discouraged. One particular question you answered is very concerning. You provided a yes answer to the question that you would kill yourself if you had the chance. Do you feel that way at this very moment? Conversely, on the Beck Scale for Suicide, you scored a 2, which puts you in the not applicable diagnostic range. One of the questions you completed had a conflicting statements from the depression assessment, as you answered that you had no desire to kill yourself and that you would save your life if should you ever find it in a life-threatening situation, and that you had a moderate to strong desire to live. Can you tell me which of these statements apply to you? Do you want to kill yourself if you had the chance, or would you save yourself should the need arise? Do you think you could have experienced any confusion when completing these two assessments? In order to gain a complete understanding, would you be willing to complete the remaining items on the Beck Scale for Suicide Ideation so that we can get a whole picture? Wonderful. Before we continue, do you have any questions about these assessments that I can address for you? Collectively, the results of these assessments indicate that you are experiencing a considerable amount of distress in your life and that you are highly anxious about what the future holds. Your answer that you would kill yourself if you had the chance, along with the scores of the depression, hopelessness, and anxiety assessments, sets off alarms for me that you need help in dealing with your distress and that suicide is of immediate concern. If you agree, I would like to schedule you for counseling sessions. Then, after a predetermined amount of time has passed and we meet from week to week, I would like you to retake these assessments so that we can gauge how effective the treatment plan is that we have implemented for you. If that is something you are willing to pursue, can we get started today?